August last year, my mum collapsed at work. Within a few hours, our lives had changed completely. She was rushed to hospital and since then has been transferred between Emerald, Rockhampton, Brisbane and Hervey Bay because the specialised care she needed simply wasn't available locally. What should have been a one-place treatment became a long journey between hospitals, hundreds of kilometres from home. One of the hardest moments came within the very first week, when my mum was transferred to Rockhampton for an MRI. Where we were told a room would be ready for her, instead, she spent 3 nights and days in the emergency department with her bed pushed up against the wall with several other patients. The only privacy she had was when a nurse cleaned the public bathroom so she could use it. She was also left on a temporary transfer bed meant to be used for 4 hours only. The nurses kept apologising because they knew it was not right, but there simply weren't enough resources. But the hardest moment for me wasn't in the hospital. It was hearing my parents, who I've always seen as dependable and strong, cry alone at night. Growing up, I believed my parents could solve anything. In that moment, I realised just how deeply this situation was affecting the whole family. Growing up, because when regional healthcare fails, it doesn't just affect the patient, it affects the whole family. For 8 months, my mum has been separated from her 4 children, not by choice, but because the care she needed simply isn't available where we live. My name is Izabella, and I am a 16-year-old living in Emerald, Central Queensland. I am one of 4 children in a family of 6. Alongside my studies, I work 2 jobs and serve as a unit leader in the Emerald Emergency Service Cadets. Through cadets, I have learned leadership, teamwork and responsibility, but over the past year, I've had to grow up quickly and navigate a system that simply isn't available. Balancing school, work, leadership responsibilities and the constant worry about my mum has taken a huge toll on my mental and emotional well-being. When families are separated for medical care, young people carry a level of stress that is often invisible. We try to stay strong for everyone, but the impact is real. What I miss most are the everyday moments. I can't just walk into the next room and talk to my mum. The small conversations most people take for granted are the ones I miss the most. Right now, my mum is living in Hervey Bay Hospital because the specialised care she needed to safely return home was declined through NDIS. I would do anything to have her back home with us where she belongs. Research from the Australia Institute of Family Studies shows when a parent experiences serious health challenges or long hospital stays, children and young people often face an increased emotional stress, anxiety and a disruption to their sense of stability. Emerald is a major mining town and a central hub for regional communities, yet access to specialised care remains limited. My family's experience is not unique. Many rural families face the same situation, travelling long distance, being separated from loved ones, and navigating a system that simply isn't built for people outside of major cities. In fact, around 24,000 people in remote Australia do not have access to primary healthcare within a 60-minute drive. In 2022 to 2023 alone, the Rural Flying Doctor Service carried out 58,839 road patients and 36,937 aeromedical retrievals, highlighting just how many people rely on long-distance care when local services aren't available. Healthcare shouldn't depend on your postcode. Young people in regional communities deserve the same access to healthcare, support, and stability as those living in metropolitan areas. I want to advocate for stronger investments in regional healthcare services, improved access to specialists in rural areas, and a greater recognition of the impact of health inequity has on families and young people. Because when we improve regional healthcare, it's not just improving and helping the patients, it's protecting families. And no child should have to grow up wondering when their loved ones will finally be able to return home. So, how many more families have to be separated before rural healthcare truly becomes a priority? Thank you. I'm Izabella, advocating for rural healthcare.